Governor Brad Little addressed the state today. He announced recommendations that align with both the White House and the CDC, but the governor clarified many times during his address that the situation is changing hourly here in Idaho.
Our focus remains the same: to slow the spread of coronavirus for two main reasons. First, to protect the elderly and health compromised, and second, to preserve capacity in our healthcare system. This is a very challenging and uncertain time, but I want to assure Idahoans we are working around the clock to expand access to testing and ensure we can handle the many aspects of our lives that are impacted by this situation.
Governor Little outlined the newest CDC guidelines that he's recommending for the state of Idaho. It's called 15 Days to Slow the Spread. It urges Idahoans to abide by these guidelines through the end of the month, beginning with the most vulnerable in our community.
Do not visit nursing homes, retirement homes, or long-term care facilities unless to provide critical assistance. But still, find alternative ways to connect with loved ones in these facilities, like phone, text, FaceTime, and others.
Little also advised people to avoid discretionary travel, social gatherings of more than 10 people, and to continue practicing good hygiene. He also recommended that the public work from home if possible.
A guest at the River of Life rescue mission in Boise has been tested for coronavirus after staff say the guest showed some symptoms. And CBS 2's Haley Kramer took part in a video conference today with the Boise rescue mission to find out how they've prepared for potential spread.
The guest was taken to the hospital yesterday for testing and was later returned to the shelter and placed in isolation while they wait for results.
The Boise Rescue Mission Ministries leadership and staff has been preparing to address the possibility of a COVID-19 outbreak at the mission facilities for over 4 weeks.
The rescue mission provides shelter to more than 400 people between their 5 shelters in Ada and Kenyon County. Reverend Bill Roscoe says there are already plans in place to isolate a sick guest or several if necessary, adding that they have always served people with serious illnesses.
Precautions that many in the community have been advised to take for COVID-19, such as sanitizing surfaces, hand washing, and good hygiene, are standard practice at the rescue mission.
As just one part of a network of rescue missions, Roscoe says they've received factual information about the disease, how to reduce the risk of infection, and what to do if a guest or staff member is sick. They're also in contact with medical experts in the Treasure Valley.
Boise's Interfaith Sanctuary is one of the many organizations here working hard to keep the virus at bay in its facility. Many of the people who stay there are vulnerable, so they're taking no chances with health. Executive Director Jodie Peterson sent us this video. She's doing temperature checks on guests to determine if someone staying there might be sick. The sanctuary has plenty of soap and hand sanitizer around, and it keeps masks and gloves within reach. Guests are also eating outside whenever possible, but Interfaith says that the safety of our community is homeless is everyone's responsibility right now.
You can self-contain right now, do that, and it's going to make such a big difference for how long this is going to go on.
Doctors say social distancing is the most effective tool to fight off the virus, and it's being encouraged at Interfaith Sanctuary. Right now, the shelter is working with a lot of their elderly volunteers who are staying at home. If anyone feels they need to help, something as simple as leaving a packed lunch at the shelter's doorstep could make a big difference. Live in the studio, Krista McPeak, CBS 2 News.